Hello, everyone. My name is Dr. Leslie Rogers. I am a psychologist and host of Mental Health Talk. And today's guest is Patty Bourne. Patty is a registered nurse, Maryland licensed massage therapist, infant massage instructor in training, future psychiatric mental health nurse practitioner. Wow, class of 2023. Great. Congratulations.
Thank you.
Oh my God, I just want to come and go so fast. Patty is a survivor of childhood sexual abuse, battled with postpartum depression after the birth of her first child. She and her youngest child both got a second chance at life in 2009 when they had a near-death experience. She lost her ex-husband to suicide in 2012, divorced, and has battled alongside with her children, supporting them through depression, suicide attempts, anxiety, ADHD, and eating disorders. Welcome, Patty. How are you doing?
Thank you so much. I'm great. I'm very honored to be here.
Good. So can you say something? I don't know if I can hear you. Say something again.
Can you hear me at all?
Yeah, now I can.
Okay.
Yeah, so, I wanted to bring you on the show because you have such an amazing story of resilience and bounce back. You've been through so much. And I think it's important. One thing the goal is for Mental Health Talk is to show people that we aren't alone. Although we suffer, adverse experiences, there's others out there that may share similar experiences as well. So my goal is to bring people on the show and tell their stories so that we can normalize these experiences. So there's a lot to discuss. We have so much to discuss.
It is so much.
I don't know if we can get it into one sitting. So how are you doing?
I'm great. I've been excited all day. Just couldn't wait to be on and just have this talk that is so incredibly necessary. So I'm excited, and I'm just really grateful that I'm able to use my voice to further this topic because it's just so necessary at this time.
Absolutely. Absolutely. It sure is, Patty. Oh my God. So you are a multifaceted woman. You do so much. Yeah. So you're a registered nurse. When did your career interest align? When did you know you wanted to be a nurse?
Well, it's interesting. In 2009, like you mentioned, my youngest son and I both had near-death experiences, and it wasn't my time to go. I always say there was more for me to get a second chance, but there were just amazing nurses that took care of me and took care of my newborn child, who I said was incredibly ill, and they got us both well. So I vowed, we both make it out of the hospital, I'm going to nursing school. I'm going to give back, and I'm going to help others the way that we were helped. And the rest is history.
So you talked about your history and your background. So let's go back a little bit. We talked about, so your parents immigrated from Peru, and you're like the first generation to live in the U.S., right? What was that experience like for you?
Well, I always jokingly say my parents may as well been from another planet, because that's how incredible from another country. When I looked at my friends who were born here in this country, their parents were born here. So it was just very, very strange. Everything that was quote unquote normal and acceptable in the American culture, it definitely was not in our home. So that was definitely challenging as a child, but made for some great stories.
Right. Now, were there cultural difference with respect to like that adjustment with respect to language? Was there a language barrier, or was it you? But you were born here, so right? So you grew up speaking English, or was there a language barrier?
Right. So the interesting piece about that is my parents didn't speak English fluently when they came to this country, yet I was born in the United States. So technically, I learned Spanish first because that's what I was hearing 24 hours a day from my parents. So my dad would have a joke that he learned how to speak English because we watched Sesame Street together. Kind of learned English afterwards. So technically Spanish first. But yes, I grew up speaking both, which in New York is affectionately known as Spanglish, which we still do to this day. It's a little bit of both.
Yeah. How was mental health discussed in your family growing up, especially with that cultural background?
Whew, interestingly enough, no. It really was not discussed. I know that there definitely was a lot of normalizing of things that are not supposed to be normal. You know, you see a lot of alcoholism, you see it common, but nobody gets any treatment for it. Everybody just kind of deals with it in the best way that they can. Clearly, that's not
Yeah.
healthy. I think a lot of people were self-medicating as a result, but not really discussed. I know there was some mental illness in my family, but not really any great detail. But there's definitely a stigma for sure in our community about mental illness. Like, it's nothing in our culture.
Mm.
So a lot of judgment, a lot of stigma. Um, that may have changed recently, but I can't imagine that it's changed very much.
Yeah. I love bringing culture in the mix. Let me tell you, whether it's in therapy setting or whether I'm talking on Clubhouse or whatever, I love to bring culture in because when we talk about culture, there's so many different approaches to therapy or talking about mental health. And it's interesting to know that, like growing up in the African American community, my family, we didn't talk about mental health much either. A lot of stuff was swept under the rug, or either, or either
Right.
we would the church and talk to the church about it, but outside of the home, that was like a no-no, right? Like a taboo.
Right.
So talking about different cultures and talk about and thinking about how you said that things weren't really addressed either in your culture either. And mental health is defined differently. I think when our mothers, you and I are probably about the same age, when our parents were growing up, I think they handled mental health as best as they could from what they've learned from their parents.
Right.
So it became a bit challenging. So I love bringing culture into it. Um, but going forward, I think that when you talk about mental health and talk about the experiences that you've had in your family, you've handled things a little bit differently from when you were growing up.
I mean, it's certainly not something that's discussed either in our culture. Just kind of do what your parents did and you pass that along, and it goes on and on and on. However, since I was born in this country, that probably is the difference. You know better, you do better. So I knew for a fact I did not want to raise my children in that sort of an environment where I grew up. Now, it's interesting because I said I would break the cycle. I wasn't exactly sure how. However, I did know better than when I grew up. Um, I grew up in New York. It's a very fast-paced environment. Certainly was not a child for very long, is what I say. My childhood was very short. And then when you experience trauma and sexual abuse and everything else, well, you definitely have to grow up pretty quickly dealing with all of um, these adult issues. That's the silver lining for me. I think about, well, why did I endure this? Or what is the good that could come out of it? And it really was to say, I know what I don't want to do. I know what kind of a parent I don't want to be. I know what kind of environment I don't want to raise my children in.
Yeah. I'm resonating on what you were saying, especially when you talk about breaking that cycle. It's a bit challenging, even as a parent myself, the mistakes that I've made in trying to break certain cycles and wondering if I'm doing the right thing as a parent, right? Raising my son. And I believe that, sometimes when we try to break those cycles, we become overprotective. And I think I was one of those moms that were overprotective because I wanted to keep my son safe. Right. So I made mistakes as a parent. And you just said that, we're not perfect. And I think it's a lifelong process when you try to break cycles because you want your kids to create new cycles, more healthy cycles for their lives. Right. So it is a bit challenging, I think.
It's very challenging. And people will hear me say this frequently. And I always say that balance is the key. So I didn't want to become that helicopter mom or being couldn't leave my sight. They couldn't be more than, 1 foot away from me at any given time because I knew that wouldn't be good for them. I also knew because of the real dangers out there, I couldn't be totally lax about it either. So I had to find a happy medium in there somewhere. And yes, that balance is difficult to achieve. Being, a survivor of childhood sexual abuse, you start to think everybody's going to abuse your children. Clearly, that's not the case. Not everyone needs a balance. So, although I had gone through my own things and never actually gotten treatment for them, never actually spoken to anyone about them, it all came to a head when I became a mom for the first time, because then all of these fears, they all came flooding in. Things I thought that I had dealt with became very much real once I was responsible for another human being. So, yeah, I didn't do it all correctly the first time, nor did I get it all right, but I see children all the time. It's like a daily occurrence. I'm sorry, I didn't handle that right. I'm going to try to do better.
When were you able to say aloud that I'm a survivor, a sexual abuse survivor?
Well, it really was not until I became a mom, like I said, for the first time. I kind of would mention it to some people if it came up, but there was a lot of shame that went along with it. Again, I had not gotten any sort of treatment or counseling for it. So I just kind of stuffed it all in. And I'm sure it was hormonal. I'm sure it was so many different factors. First time mom, the fear of, oh my gosh, now I really am responsible for this person. All of these things combined really just, it all came to a head. Whether I wanted to deal with it or not, I was going to deal with it at that time. So telling a total stranger about it, consciously wanting to tell them to have it just slip out or it out, that was tough. And that was
Mhm.
just like everything else, you have to talk about things until they're no longer uncomfortable or painful, is something that I live by. So it's okay
Yeah.
to discuss now, but at that time, oh my gosh, it was really, really tough.
Mhm. Yeah. It's, you know, processing through all that trauma and being able to talk about it aloud. Let me tell you, coming on this platform and, you know, saying this is what has happened to me and this is my history, this is my experience, I think is courageous and very brave. And you should be proud of yourself to where you've come today. That is so awesome. Hmm.
Thank
Yeah.
you.
Because, you know, it
Just
takes time to go
definitely,
through those processes.
I'm sorry, go ahead, say that again.
No, I just said it takes time to go through those processes. It's not something that you can just do overnight.
No, no. Definitely can't achieve that overnight, but I definitely feel like I've come to a place in my life where that's just part of my journey. It certainly doesn't define me. It
Yeah.
certainly does not take away from all of the great things that I'm just one little snippet, and everybody's journey looks slightly different. That just happens to be mine, but by no means does it define me. So I speak all of my truths because you never know who's listening. You never know who you're inspiring or who you're actually going to move and say, oh, wow, there's someone else that went through what I went through and she's okay. So,
Yes.
yeah,
And I think those initial stages when you go through that shame, embarrassment, and guilt is when you're walking through that process, right? And that's what interferes with healing. But being able to process those manufactured emotions that we go through and being able to say, I'm okay, this has happened, it doesn't define me. And that's another thing that interferes with healing too. A trauma having defined who you are, right? And then you know, can possibly potentially result in anxiety, depression, and things of that sort. So I'm glad that you spoke up and said that. We all define
oh,
trauma
absolutely.
differently. We all respond to trauma differently. But I think that what's similar between a lot of different people is that shame and guilt that you feel after a traumatic event, especially sexual trauma. And so when you talk about these times, and then, you know, it seems like things are just piling on top of each other. And then you talk about your experience with suicide, where your ex-husband committed suicide and how that impacted your children as well, their mental health. Holistically, everyone's mental health, right?
Everybody, yeah. But absolutely, it impacted our entire family. I had just entered the last semester of nursing school, which is the hardest, when he passed. And my first reaction was to actually quit school. I can't possibly continue. My children are grieving. This is the end. How will we live? I'm in school. I'm not even working. How do we do this? So my first instinct was to drop out of nursing school, but A really great childhood friend of mine said, "You can't do that. If you do that, you'll be no better off than when you started. You have to continue." So I did, but by no means did I ever see this. I did not think that it would come to be. But I was grateful that I was there for my children, or they could have been orphans. Who knows? And what a devastating outcome that would have been.
Mm-hmm.
But counseling right after their father passed, because yeah, that was I didn't know how to hold it together for myself, much less do anything other than get them into treatment.
Mm-hmm. You know, one thing I hear you talk about, Patty, is how you've helped others, but I haven't heard yet you talk about how you've helped yourself. So have there been experiences with therapy or where you've actually helped yourself as well?
Well, I also immediately went into grief therapy myself because I could not possibly, I immediately failed a nursing exam. Immediately after he passed, I had an exam and I failed it badly. And I had to talk to someone to be able to just compartmentalize what was going on long enough to continue to finish. But I by no means was able to do that on my own. So luckily there were services at the college that we could utilize. I forgot how many sessions they gave us for free. Just sign up and talk to a therapist. That was the only way that I
Mm-hmm.
was able to get through. And to have the wherewithal to be able to get my children into treatment, because literally my whole world came crashing down. I couldn't make heads or tails of any depression. Definitely went to therapy, and it got me through that rough patch. Again, when my ex-husband passed, and then again when I had my near-death experience, it truly was traumatic for me to think everything was fine, and then next thing I know, we're both fighting for our lives, and we both had multiple surgeries. It was really difficult for me to get past that. So I've benefited greatly from therapy.
Mm-hmm. Good. Yeah.
Everybody should go periodically. It's a must.
Mm-hmm. I agree. I think that it's a place where you can go without being judged, and you can talk freely. I
Right.
do. I believe that, especially when you're dealing with trauma and complex traumas too. When you talk about complex traumas, meaning not just one trauma, you've been through multiple traumas. Um, you need to be able to process through that, process through all those negative emotions, process through all those guilt and self-blame and all this, these emotions, so you can, reach healing and acceptance, so you can live a more productive life. So how do you talk to your children about these complex traumas, right? And getting them through, even, with everything that you all have been through, how do you talk to children about traumatic experience? And the second question is, as being a nurse, does that kind of help it become a little bit easier?
So being a nurse and different people, and every time we add the whole family dynamic piece in there, these conversations can really be um, trying, tumultuous, whatever you want to call them. But psychiatry definitely comes into play because we have all these different personalities most of the times in not a desirable setting. So we really have to be able to be calm and know what to say, definitely. But I try to always talk to my children about things, difficult things that I know that parents don't want to talk to their children about. And I say that there are tons of teachable moments that we have with our children. We just have to be astute enough to pick up on them. But there are countless opportunities that we have to teach empathy, to teach caring, to teach kindness, to teach love. And I will use myself very work or deal with someone that was difficult, and I'll come home and tell my kids, look, this is what I went through today. I did or I didn't get it right. If I should go back and fix it, I'll let them
Yeah.
know I have to go back and fix it. And sometimes I'll say, what would you have done in this situation? Or has this ever happened to you? So I don't necessarily wait for there to be a crisis. It's just something that we discuss while I'm making dinner or while somebody's loading up the dishes. dishwasher. We just normalize times. Caregiver stress is a real thing. My children know if I come home and I say, I just need everyone to not talk to me for 30 minutes, and I go lock myself in my room, they know, okay, no problem. Mom had a rough day. Like, we just have that understanding. And I let them know it's okay. Sometimes we just need a little bit of time to ourselves. Just don't stay there too long. Saying, I don't wait for there to be a crisis. I try to have these talks with my children frequently, and make them just very matter of fact. I don't dumb anything down for them. There's no right or wrong answer. We're just all going to respond differently based on our life experiences and where we've been.
Absolutely. And proactive and intervene to kind of counter negative things from happening. And I love that because, again, when you talk to children and prepare them, it not only lets them know that it's okay, but it lets them know that it's okay to talk about emotional experiences. It's okay to talk about these things, and you don't have to hide it or shut it up. And I think that with you, and I think that it's important for everyone here, especially those out there that have children, to understand how to engage in this dialogue with children. Because I think that when you talk about parents and talk about kids that have gone through trauma, even suicidal ideations or suicidal attempts and things of that sort, me as a mom, how do you stop yourself from being overbearing, to make sure you're keeping them safe? Because, as a mother, how do you keep yourself from being overbearing? We talked about that earlier, about trying to keep the children safe because of our traumas. But then when they go through traumas, I think it's like accelerated, or like, you know what I mean?
Right. Well, the first rule is don't freak out. Definitely don't freak out. What I tell my children is we are not our thoughts, right? So we have a gazillion. It doesn't really mean anything, right? Sometimes we just have a thought. Does it mean we're going to act on it? Does it mean that that's what we really want to do? It's just a thought. So if your child tells you that they had a thought about something, just try not to panic. I tell my children all the time, it's just a thought and we're not our thoughts. So clearly that's different if somebody has depression and they're having a mental health crisis. That's totally different. And that's not what I'm feelings, right? And they're not good, they're not bad, they just are. So I try to not give a negative connotation to anger or sadness or anything like that. I just kind of say, yeah, you know what? Sometimes not every day is a great day, and that's okay. What do you like to do to make yourself feel a little bit better, or what helps you when you feel this way? So we'll talk about that stuff. It's hard as a parent. We really can't, and we shouldn't. These experiences are meant to teach them lots of things. So I try not to get involved right away unless I know it's something serious.
Yeah. Mm-hmm. And I've had parents ask me, if I think that the child isn't serious. If the child tells me I'm thinking about killing myself, I want to kill myself because they're angry, right? Should I take it seriously? I always think you should take it seriously. If anyone says that I'm going to kill myself or I'm thinking about suicide, absolutely take it seriously, even if they're joking. Because I believe that if you say it, then guess what? The risk of you thinking it is high. I just don't think you say something just to be saying it. Not saying that you're going to act or go through with it, because there's those subtle cues or subtle suicidal thoughts that, like, I wish I wouldn't wake up in the morning, or if God takes me away tomorrow, I will be okay, right, with no plan. So you do have to take these things seriously, especially with kids, and especially during this time when we're in a national pandemic. They're isolated, they're withdrawn from their friends and support system. I know they're gradually going back to school, but still those anxieties are there about going back to school, right? So being able to talk to your kids and say, hey, babe, is everything okay today? How was school today? Or how did things go today? How are you feeling today? And then normalize it with disclosing how you feel. I'm anxious myself. I'm a bit anxious, about, you going back to school, or I'm a bit anxious about me going back to work, so that you can normalize those discussions. I always believe that if you disclose to your children, talk to your children about how you feel, and then you model for them how to feel and how to behave and how to think and how to express those to you. So absolutely.
And
This is a great conversation.
Yeah, if I can piggyback on that for a moment, and parents parents also should not give the illusion that they have everything under control, or that they do it all right, or that they have all the answers, because children are like, well, my mom could do, why am I struggling? We don't need to paint an inaccurate picture of what our struggles are. Many times I don't have the answers, and I say that freely and willingly, and I'll ask other people for help. I don't claim to know everything, but ask your children the difficult questions, and you have to be prepared for the answer. But remember that the more you talk about this, the easier that it gets.
Mhm.
But we can't ignore the elephant in the room. Find someone who does know, go to family therapy together, maybe find the answer together. But by all means, don't ignore, don't not have the conversations because you're not equipped or don't feel prepared enough for the response. I think that does them a disservice.
Um, Patty, so what coping skills do you and your children have in place to kind of navigate through the experiences?
Well, I have 3 boys, and what I'll say is they are talkers. They all talk. I've always said when they don't talk, that's when I'll be concerned. That's when I'll be worried. Other times they talk too much, and I say, I should have taught you guys sign language because, oh my gosh, stop talking to me. It's too much. I think it's great. We talk about it. I mean, that's the first thing is, I know your instincts are maybe telling you to isolate. I know you want to go in your room and be alone. Fight that urge. Stay here with me. Talk to me. Can you call a friend? Can you read a book? What will help you right now? So my children will tend to kind of isolate sometimes, and I have to remind them, I know that's your first instinct. However, that's approach at this time. You can be alone for a little bit, stay there. You need to be around the people who love and care about you. And that's, you need to be around people. It's the exact opposite, is what I tell them. So they all have little things though that are different. Some of them say, I'll be fine after we talk, I'll be okay. And I trust them and I let them do their thing. But each one is different. Some are very involved in music and they'll go listen to their music, like that's their therapy. Size, they'll go lift up some weights and they'll, feel better. Others want to talk about it. Each child is different. And I say they're all individuals. Let them do it how they see fit or what they know what works for them. And I have my own. My own are completely different from my children's, but know what works for you. They should know what works for them as well.
One thing you said earlier that I really appreciate was, when you come into the house, you'll say, give me about 30 minutes to myself. And I think, but actually, I think that's a good strategy because that models to them. Hey, listen, when you want to get by yourself, say, give me about 10, 15, 20 minutes. Let me be by myself. And then, let's talk later. Right. So I think that's a good way to model.
Like I've said, I've apologized to my children a lot, and it's lots of times because I said the wrong thing at the wrong time. So I learned, unfortunately, through trial and error, if I'm not in a great, what comes out of my mouth is not going to be nice or appropriate. I have learned that the hard way. So instead of unleashing that on my children and then have to apologize afterwards and really, cause scars that are not visible to the naked eye, but it hurts them, I say, listen, I know you want to tell me X, Y, and Z. If you're concerned that you'll forget about what you want to tell me, write it down real quick. Set a timer for 30 minutes and I'll come out and we can show you want to catch me up on. And I stay true to my word. If I say 30 minutes, it's 30 minutes.
Absolutely. Yeah. Oh my gosh, this was such a great discussion because not only we talked about mental health and multiple traumas, but we talked about children as well, which I think is, oh my gosh, it's such an important topic to talk about children because like you said, we as parents, sometimes we become anxious when we have to have these difficult discussions, because sometimes we don't know how to deal with it. I mean, how do you deal with a child coming to you saying that I'm thinking about suicide, right? What do you do? Do I take them to the hospital when they're saying no, they don't want to go to the hospital so they can be upset with us? Or what do I do? And what would you say if someone asks that question? If my child said that they were suicidal, should I take them to the hospital immediately? Or what would be your response?
Well, we as parents know our children the best. And what I can say is listen to your gut. If something inside of you is telling you that something's not right, and you hear anything that remotely they are thinking of hurting themselves, or it is not a gamble that you would like to take. I don't think any parent should take that gamble. Yes, they absolutely should take them. Is it something that the children are going to be happy about? No. I had to do it with one of my own children, and it was absolutely devastating. And I said, "Oh my gosh, I'm the worst parent in the world." And so many of my friends said, "No, you're the best parent in the world because you made sure your child was safe." So what's paramount is keeping them safe. So should you take them? Absolutely. Not a time to find out, unfortunately, after they've hurt themselves, that it was not a bluff. So definitely never, ever, ever take any threat not seriously. It's a very much a serious thing. And whether they understand the significance of it or not, again, that's a conversation for another day. But we have to make sure that our children are safe.
Exactly. And guys, this isn't only for children, it's for adults too.
Yeah, for
Adults
adults.
too. If you have someone that are saying they're suicidal, that becomes a crisis. It's critical that you get them to safety. If they're not with you in the home, then find out where they are, and potentially either you go there or call the police, call the authorities to go keep them safe. Okay, so lastly, before we end, and then I'm going to go to the viewers because we have some comments. Projects. What projects are you working on, girl?
What am I not working on? I have my hands in so many things. One day I'll decide what I want to be when I grow up, I actually am still working on my infant massage certification, so I just have to find a couple more families to. I'm excited about that. I've been doing them virtually, which is really nice for COVID. Who would ever think we'd have to do that? But still, it still works. I have some couples massage workshops that I'm actually scheduling. Something that's really important to me. I really like to help people stay well and to stay healthy. So I can't reach very many people one-on-one individually, but if I have a group of people, I definitely can a bit quicker. So on Eventbrite, you'll see people that are local here to Maryland. They can see my classes that are forming for my workshop. But definitely, I want to continue the conversation about mental illness. It's not going to go away, not at all, especially post-COVID. It is going to be more and more of a problem, as I've discussed in the past. People working from home and home life are so blurred right now, and I hear from so many people that they're struggling. So I want to continue to have platforms like yours to just say, hey, you're not alone. We can normalize this discussion, this very necessary conversation, and reduce the stigma. I don't know about eliminate it, but we sure can reduce it, and that's my goal.
Yeah, exactly. That intervention, right? All we can do is be proactive and put measures in place to intervene, right? And I think it's a great job, a great thing to do, because now with everyone discussing mental health, especially in lieu of COVID, because after COVID, everyone started, discussing mental health. And guess what? It creates platforms for discussion. And like you said, it normalizes. And it normalizes because guess what? Because it validates what people are feeling. People are talking about it now. So they're like, oh my God, he feels the same way I feel. Oh my gosh, she feels the same way I feel. Even kids, right? I wonder if there's like support groups out there for children where children can come together and communicate on mental health. That would be awesome. I need to look that up and see if there's any out there.
Right. Going to school virtually that did a number on our kids. And I'm not so certain that we know the ramifications of that yet. I don't think we have a full grasp on what that has done. So it'd be interesting to see what happens over the next 12 months or so.
Yeah. And well, we do know that academically kids were declining academically from being home. That's why I think that they were so much in a rush to get kids back into the school system. But even though kids are in the school system, even when they go to school, I think I've heard some teachers are still virtual in the school. So it's interesting.
But today I got a great little message. It said, thank you for what you do and the people you inspire. Thank you for speaking for people who may not know how to or what to say. There are a lot of people out there that appreciate you. And that's exactly why I do what I do. You never know who you're touching. You never know who you're affecting in a positive way.
Absolutely. And you're absolutely right. And working with the VA, with the veteran population was such a rewarding experience. And when I left, I realized how much of an impact that I had on veterans and their growth and maturity and, towards healing and recovery. And, I think that it's awesome when one of them, a couple of veterans found me on Facebook and wrote me notes about how much they appreciated me. And it makes you feel appreciative and that I love what I do. I love what I do. Now, when I take the hat off and become Leslie, I'm just like anyone else, and I have struggles too. But then I put that hat on and I'm Dr. Rogers, and there's another set of experiences there as well. So thank you guys so much for tuning in. This has been an awesome experience, awesome show, Patty, and I absolutely adore you. So guys, this is
mutual.
Dr. Leslie Rogers again. Girl, you just have so much energy and so much awareness to spread and so much. I'm telling you, we might have to do a part 2.
Yep.
So guys, again, this is Dr. Leslie Rogers, and until next time, peace and blessings, and I will see you soon.
Thanks, everybody. Night.